What causes septic shock? Septic shock is a severe and life-threatening condition that occurs as a complication of an infection, typically a bacterial infection. It is characterized by a widespread and overwhelming inflammatory response in the body. The primary cause of septic shock is the presence of bacteria or other pathogens in the bloodstream, which triggers an exaggerated immune response. This immune response can lead to the release of inflammatory substances, such as cytokines, that cause widespread inflammation and damage to tissues and organs. Common sources of infection that can lead to septic shock include 1. Bacterial infections. Bacterial infections are the most common cause of septic shock. These infections can originate from various sources, such as pneumonia, urinary tract infections, skin infections, intra-abdominal infections, or infections related to surgical procedures. 2. Fungal or viral infections. While less common, fungal or viral infections can also lead to septic shock. Examples include severe cases of influenza, certain types of viral hepatitis, or invasive fungal infections. Several risk factors can increase the susceptibility to developing septic shock. 1. Weakened immune system. Individuals with compromised immune systems, such as those with HIV/AIDS, undergoing chemotherapy, or receiving immunosuppressive medications, are more vulnerable to developing septic shock. 2. Advanced age. The elderly population, due to age-related changes in the immune system and higher prevalence of chronic health conditions, is at increased risk. 3. Chronic health conditions. People with chronic conditions, such as diabetes, kidney or liver disease, lung disease, or heart disease, have a higher likelihood of developing septic shock. 4. Invasive medical procedures. Procedures that involve the insertion of medical devices, such as intravenous catheters or urinary catheters, or those involving surgical interventions, carry a risk of introducing bacteria into the bloodstream. 5. Recent hospitalization. Hospital-acquired infections pose a higher risk for septic shock, particularly if the causative bacteria are resistant to antibiotics. Early recognition and prompt treatment of infections are crucial in preventing septic shock. Timely administration of appropriate antibiotics, fluid resuscitation, and supportive care in an intensive care setting are vital to improving outcomes for individuals with septic shock.